The Guam Regional Medical City's emergency room saw its first patient in the ER this morning as they finally opened up their emergency services to the public, a milestone for the new hospital and for the island. But many are still wondering which health insurance carriers they accept. Here's more. It's a brand new day for the Guam Regional Medical City. They've reached yet another milestone today, finally opening up their emergency room to the public. GRMC had just held their grand opening in July, but at the time, their emergency services were not yet available. ER Director Dr. James Murphy sat down with us today to give us an idea of how their first day went.
So far, well, we're only seeing our first patient at this time. But we've had a lot of contact with EMS and them visiting us and explaining as far as how we're operating and how we'll operate together.
Having been in emergency medicine for nearly 30 years, Dr. Murphy says GRMC's ER is just like any other. At this time, he says, GMH and GRMC's ER services are pretty similar.
So people are saying, what's here, what's different? They're pretty much the same. But going forward, we have expectations of bringing out a cardiac team and providing cardiac surgery and ballooning and stenting heart attacks acutely for the ones that meet that indication. And those are things we've never been able to do on Guam.
So which health insurances do they accept? Well, that depends. For emergency services, federal law requires that all insurance companies, whether they have signed an agreement with the hospital or not, must cover emergency care. For all other services, at this point, GRMC accepts insurance coverage from NetCare, United Healthcare, and Blue Cross Blue Shield. They also accept TriWest with proper authorization from the Veterans Administration. Calvo Select Care Plan Administrator Frank Campillo announced on the K57 Breakfast Show this morning with host Ray Gibson that they are close to signing a deal with the new hospital. As for Medicare and Medicaid, while they are not yet certified with the Centers for Medicare and Medicaid, GRMC says it will accept patients with Medicare or Medicaid and will only bill the patient for their standard portion of their agreement, just as any other CMS certified hospital or facility would. Ultimately, and it's important to note that GRMC is strictly bound by EMTALA regulations, which means they cannot turn patients away based on their ability to pay. GRMC's ER has an 11-bed capacity with room for more if necessary. They also have what's called an ER fast track, which is similar to urgent care in a hospital setting. For more on GRMC's ER, log on to PacificNewsCenter.com.